I'm Dr. Henrietta Ewart, Director of Public Health in the Department of Health and Social Care on the Isle of Man. Each year, the Director of Public Health publishes an annual report looking at an aspect of the health of our population. And this year, I've chosen childhood overweight and obesity as the topic to focus on. The reason for this is that 25% of our children here on Island are overweight or obese when they arrive in reception class. This makes childhood overweight and obesity the most pressing public health challenge that we face as a population. And I am very keen to open the debate on what we do about this and get some agreed actions to address the problem. Our figures for overweight and obesity at age 5 are very similar to those in England, and those in turn are similar to the rates across the developed world and increasingly across the world generally. That means that we are part of the obesity epidemic. Despite all the environmental advantages that we enjoy on Island, we do have obesity rates that resemble those in other areas, and therefore the challenges are similar to those faced in those other areas, and we need to explore solutions just as they need to. The response to childhood obesity doesn't lie with any one government body or department. There is actually very little that the Department of Health and Social Care can do on its own. The determinants of obesity really lie in the environment and the lifestyles that have become so prevalent at this point in the 21st century. So that's a mixture of diets that contain more calories than we need, taking less physical activity than we need to burn off those calories, and therefore the result is increasing weight. There may be all sorts of fine arguments that one can look at within that around the constituents of diet, patterns of dietary habits and patterns of exercise, but the fundamental relationship between food consumed and calories burnt off through exercise remain, and we can see from the results that we have here on Island that clearly that balance has come adrift. So what I hope to do with this report is actually stimulate discussion across government and beyond as to what we can do to address the environment, to try and make the healthy choices that would help us achieve and maintain a healthy weight, the easy ones. In terms of the environment, the key elements there are the food environment, how we make food choices and the background against which we do this. And also in terms of the environment, there's the opportunity for physical activity, and we need to get all of that right. That's not something that DHSC can do. We need to look at the settings in which we live our lives and the places in which we live out large chunks of our life. So for children and young people, that's schools and colleges. For working age people, that's the work environment. And then there's our communities, the way our community environments are laid out, the opportunities we have in communities, the environments we have in communities. And we need to look at all of that and how we can tackle it to encourage better eating choices and better physical activity levels. We have plans to actually open and take forward the debate around strategy for reducing childhood overweight and obesity, and that will start with a meeting for members of the House of Keys in September, and then discussions with government departments going on beyond that. So I hope that next year in my annual report I will be able to set out what actions are underway in order to take forward joint work on this.